Gauteng Finance MEC Lebogang Maile has retabled the province's 2025-26 budget following significant amendments to the national fiscal framework, which were triggered by the ongoing issues around global economic uncertainty. Now, despite fiscal pressures, Maile successfully secured an additional 868, I think it is. Yes, it's 886, pardon me, 886 million rand, bringing the total provincial budget to just over 172 billion rand. Now, the Gauteng Health Department has been allocated 67.1 billion, the total projected allocation of 141.9 billion over the medium-term expenditure framework. But the revised budget has drawn criticism from opposition parties and the Democratic Nursing Organisation of South Africa, that's DENOSA. Let's unpack the story further. Professor Alex van den Heever is a social systems expert at Wits School of Governance. Prof, it's great to talk to you. Thanks very much for coming on. I mean, we know that the lion's share of the budget does go to health and to education, but I suppose what organisations like DENOSA are upset about is that this additional boost to the budget didn't mean a boost to health and education as well.
Yeah, so it's a question as to where those funds go, because sometimes pet projects are introduced which are not really the core business of the provincial government. So the core business at the moment would be health, basic education and infrastructure. Those would be key, including housing as part of the sort of in support, in conjunction with the infrastructure. So those are priorities and you have to get those right. So the nice to haves are actually taking money away from those core programs, and health is under pressure. And the question really is whether, in fact, health has been shortchanged, as well as basic education, both of whom suffered cost increases in the last 2 financial years that were not fully accommodated in the budget allocations.
Right. Health is hugely under pressure in Gauteng. I mean, we've just seen the closure of an essential a cervical cancer clinic at the hospital escapes me now. Perhaps you can help me, Prof. But essentially, it's the second most prolific cancer in South Africa. The closure of this clinic means, and it's due to US funding cuts, means that a whole range of people won't be able to receive treatment. We've got tens of thousands of people waiting for cancer treatment in our public hospitals as well. I mean, it's at a crisis level.
Yeah, so part of the problem in oncology treatment and the cancer services was that there's a backlog. The equipment had failed and needed to be repaired, couldn't be repaired in time. Money was allocated for that, and also to accommodate those patients in the private sector. None of it was spent. And so the backlog remains. So patients are now going to die because they can't get off the waiting lists. If you go to a province such as the Western Cape, they will have the same turnaround times as the private sector. So if you're diagnosed, you immediately go into, within the reasonable standard protocol, you'll go into treatment. That's not the case in Gauteng. So there's a collapse of these services. So yes, so there's a problem that even if the money is allocated, it doesn't get addressed. But there is also an issue about shifting resources away from the health department and using them for critical care, critical services and functions. The collapse of the USAID-funded programs is a serious matter that has to be looked at structurally. It's a very difficult one to solve in the very short time in which the United States government, in its wisdom, decided to impose on all the different various countries. It was a shabby treatment given to many people who are contributing extensively to both science and treatment of healthcare around the world. But again, that type of issue would have been a priority. And the question is why it's not as well within the provincial government in Gauteng.
Yeah, absolutely. And that cervical cancer unit was at Helen Joseph Hospital. Professor, how do we get to a backlog for cancer treatments of almost 35,000 patients?
So, on the one hand, the issue is funds were allocated for this. So this wasn't only a matter of not having money. That's why there is a court case dealing with this. Section 27 has taken the Gauteng Department of Health to court. And they have been instructed essentially by the courts to now provide these services. But the problem is that they're just not providing them, and it's unclear what is going on. Funds were returned to National Treasury for this function. So this is a problem. There is huge incompetence in the Gauteng Department of Health. There are clearly concerns about its capability and its ability to carry out its normal functions. But this kind of issue, including many other aspects of the Provincial Health Department, are not being properly and adequately addressed. There are significant problems with irregular expenditure, significant problems with unauthorized expenditure within the Gauteng Department of Health, all of which have been sustained over a long period of time. They're not things that just happened last year. They're just never addressed, suggesting that there are key weaknesses at the leadership level within the provincial government. And it's very difficult then to translate any kind of financial resources into some kind of proper and adequate and efficient service delivery at the end of the day. So part of it is resources, and other part is there's a clear problem with leadership.
So you're talking about the case in March of this year where the High Court in Gauteng essentially said that it was unlawful and unconstitutional that the department, the provincial department, was refusing or failing to provide radiation treatment to cancer patients, right?
That is correct. And there is absolutely no reason for it. Nobody can cry lack of resources. Money was made available. It just wasn't spent. For some or other reason, the Gauteng Department of Health did nothing. And many people are going to face severe consequences because of this. So there's no clear response. So
in the order that was contained in that judgment, the department the health MEC was given 45 days to update the backlog list of cancer patients awaiting radiation oncology services. I'm reading verbatim from the judgment here, but was that done? And updating the list, how far does that go to actually providing the treatment?
I think it just makes it transparent. It doesn't actually go, because you've got practical problems to solve. So if you're treating in the private sector, and you've got to basically contract for it, and you've got to make provision for it, you've got to make arrangements. It's a whole approach that must be implemented. It's unclear how much has been implemented and whether they can actually do that. In terms of the provincial services, the radiation oncology services, equipment had to be replaced, and that would take time. Now, the question is, where is that? Now that what the courts were effectively saying is you must treat the patients in the meantime while you fix up the services in the province. They appear not to have done either properly. So it's very unclear where they are in rectifying the oncology services that the province can provide and whether or not they can contract to eliminate the backlog. But it's scandalous that people are left without treatment in the public sector when funds are available. Yeah. And funds were available to use for private sector patients, private sector services.
I mean, it sounds like we're about to have, if we haven't already had, a repeat of the Life Isidimeni scandal. I mean, there are time frames involved with cancer patients, literal time frames down to the day, 90 days to do radiation treatment. It's not the kind of service delivery that we can put off. You know, the Gauteng Premier's apology to cancer patients in May, I think it was, Banyaza Lesufi saying he was sorry that cancer patients were experiencing this delay. I mean, it's almost laughable if it wasn't a life or death situation.
Yeah, sorry doesn't really cut it. There's a question as to whether or not there's medical legal liability that has been incurred because of these delays. But the province might evade it because essentially what they're doing is just not treating. The patients aren't in the services. But just doing nothing is terrible. And it just shows that the government, Gauteng government, unfortunately appears to have lost connection with the population and with the people it serves. You can't do this. So it is different to Life Isidimeni in the way in which the harm to the patients is incurred. In the Life Esidimeni case, the people were in treatment facilities that had been arranged by the Gauteng Department of Health. In this case, they're just not being treated, so they're at home.
Yeah. I mentioned in my introduction to our interview, Denosa, the nursing union, talking about just the way health is so under-resourced in Gauteng. And they mentioned one hospital, like Chris Hani Baragwanath Hospital. They talk about 76 wards, 70 patients each. At night, you have one professional nurse, 2 enrolled nurses, and 3 enrolled nursing assistants. I mean, these are hundreds of patients we're talking about.
Yeah, so it's very unclear how the resourcing is operating. A lot will not be very clear to the public unless you can systematically analyze what's going on within each of these facilities. The Gauteng Department of Health employs around about 76,000 people. It's enormous. The question is whether they have fallen behind the growth in population over the last sort of 10 to 15 years. That's quite probable. But there doesn't appear to be a consistent relationship between the up-resourcing of the province and the changes in the demand for services. It's very unclear. The expansion of hospital beds and hospital services has not necessarily kept at the pace of the population change. Right. The other problem is that the primary care system is not really effectively preventing hospitalizations and operating as a first line of prevention. Very difficult to do that. Requires a very sophisticated and well-run primary care system, and we don't really have it. Doesn't mean we don't have good people at the front end, but it's not necessarily preventing people from getting sicker if you don't diagnose them early enough. But we're also seeing that what we're seeing just in the oncology services is one feature of what goes wrong. You're sending people in for care and they just don't get it. And this can be hidden in a health service. It's there, you can walk through the doors, but you don't get the service at the end of the day. It's right. Free, but you get nothing. And that's why there has to be a much better governance framework in place for our provincial hospital services. This kind of situation is going to get worse over time. But I think that the Denosa definitely has a key issue to raise here. But these are complex problems, and I'm not sure that this department is able to resolve them.
Sure. And we will continue to discuss Gauteng health. And just perhaps as a last comment from you, Prof, how much of a role does corruption play in the state of what's going on?
Well, when you look at irregular expenditure of round about 3 billion rand a year in the Gauteng Department of Health, all of those, all of that irregular expenditure is a proxy indicator of the levels of corruption. Now, it's not in a single year. It is over, you can look at it over a 10-year period where it's sort of roughly 2.5 to 3% of overall expenditure, and it doesn't change ever. So these are all cases where they don't comply with procurement rules. And if you don't comply with procurement rules, the inference that you draw is that these are irregular, these are improperly allocated tenders. So that's what we see on the tender side. When you're procuring those services. But if there's such levels of corruption in the department, it can go through almost every sphere of the department, not only tenders, appointments, ghost appointments, and all of those drain finances from the department as well. There's an indication, if you had to look at in cases like Tembisa, etc., where people spend billions on consumables and surgicals, etc., and equipment that probably weren't even delivered to the hospital. And so also the money flows out. So it can have a devastating effect on a department. Yeah, well, certainly. I mean, we talk about corruption not being a victimless crime. It's never more true than when you're talking about a health department. Professor Alex van Den Heever, let me thank you for your time this afternoon. He's a social systems expert at Wits School of Governance.